Hi, everyone. Welcome to DINET Discussions, a speaker series. My name is Lauren Malak, and I'm the Vice President of the Board of Directors for DINET, or the Dysautonomia Information Network. Before we begin, I would like to thank our sponsor, Banana Bag Oral Solution, who has been a huge supporter of DINET and the POTS and dysautonomia community. They have a product that you can add to any kind of liquid, water, or whatever that gives you the benefits of an IV without the actual IV. And during the month of October, they have very generously offered to donate a portion of their proceeds to DINET. And if you go in the description, there's a link to their website, the discount code, and all the information you need to know to learn more. Today's topic is a roundtable discussion, a collaboration for better patient outcomes. We are very excited to be putting on this fourth and final part of our speaker series. So joining me today first is Roiza Helfand. Roiza is an emergency medical responder in upstate New York, as well as a POTS patient and advocate. Her own experiences with POTS, coupled with her professional background, put her in a unique position to understand the barriers to appropriate emergency medical treatment faced by dysautonomia patients. This led Roiza to partner with DINET to research patient-perceived issues in emergency dysautonomia treatment and to train first responders. Roiza also volunteers as Education Events Coordinator for My Team, a chronic illness support and awareness organization. Roiza, thank you for joining us.
Hello. Nice to be here.
Next on our panel is Natasha Norman. Natasha is a research assistant for My Path Story Booth project for the University of Pittsburgh. The project centers around interviewing patients, caregivers, and healthcare providers about their experience within healthcare. The goal of this project is to inspire health researchers to focus on topics that matter to patients and to design studies where participation is a valued and meaningful experience. Hi, Natasha. Thank you for joining us.
Hello. Thank you for inviting me.
And our final panelist today, you might notice or recognize her, is Ellen Driscoll, President and Board of Directors of DINET. She is also the managing editor of our website and our patient forum. Ellen has also lived with multiple chronic illnesses, including dysautonomia, for many years. Hi, Ellen.
Hi,
how are you?
Good to be here again. Very good to be here again. Welcome, everyone.
So first, we're going to talk about a few different points and kind of go into a roundtable format for an open discussion. So the first question, I'm kind of going to start with Roiza, because you have a medical background. So when it comes to communication and education, how can a patient help educate with doctors who mean well without overwhelming them or scaring them with their health problems and needs?
So for doctors who are truly well-intentioned, appreciation is key. Although frustration is natural and understandable, unfortunately, when dealing with chronic illness, it's vital to treat physicians with respect and give them credit when they at least try to help. So dysautonomia patients are complex, difficult, and it's important to recognize that those doctors at least are doing their best. So appreciation goes a long way towards preventing burnout.
Yeah, definitely. Ellen, how about you? What do you think? I mean, I know with the not well-intentioned, sometimes when you see a physician, you can only go so far, and you know that at the end of the day, they're not going to listen to you. But with the good ones, what do you think from a patient point of view?
Well, I think, as you said, if a doctor is not open to educating themselves and really listening to you, then you need to move on. There's no point. There really isn't. But with the well-intentioned doctors, I think if they're open to it, bringing them medical articles, sometimes hearing your symptoms and then giving them something, a point of reference that they can pursue themselves, I've found to be very helpful, rather than just say, I read this, because they don't know what source you're referring to. So backing up your statements or your own research, I think, is really helpful for most doctors. And then they take it from there.
And Natasha, have you heard a lot from Story Booth of patients that struggle with this or something like this?
Most definitely. I think we all made the distinction that we are talking about well-intentioned doctors.
Yes.
And I think that's also important because a lot of the people I interview, whether they're caregivers or patients, they're always saying like, they're always talking about doctors who aren't well-intentioned, who aren't willing to listen and sit there. And they are very understanding. I think patients are very understanding that doctors are busy and times are short. And they try to do as much as they can, but a lot of their patients are expertise on their goals, on their constraints, on what happened outside of the hospital. And so they really want to give you all that information. And I think when it comes to well-intentioned doctors, patients see that and they notice that. And even the frustration, they're willing to understand. But I think if you're really pushing for collaboration and you're really trying to get high quality medical care, you gotta really share and be intentional with listening to your patients, and patients as well, taking that extra step to be like, this is what's going on with me every day. This is how I'm doing. And this is what I found, support groups, such like that. So yeah, what everyone else said was very spot on from what I've heard.
Yeah.
From the mouth. So
yeah, I think most of us can definitely relate to that on a very personal level. So I guess we'll start with Rosa again. So how likely is a doctor to take responsibility for learning about a rare chronic illness? So you go to see, say, a cardiologist, and they've never heard of POTS or dysautonomia. So is it their responsibility to learn about the condition, or is it more that they refer to the patient to someone who knows more, or is it the doctor's decision to decide which?
So again, it depends on the doctor. Some will continue treating the patient, completely ignoring the fact that they aren't knowledgeable about the condition. Others recognize at least that they're missing information, but they'll just refer the patient to someone else, and they shirk responsibility that way. The patient gets passed from doctor to doctor, specialty to specialty. Very few actually do the research and work hard to learn about the condition. So it's mainly dependent on what kind of person the doctor is, and if he or she genuinely cares about the patient and is willing to go the extra mile on their behalf.
Yeah, again, all of this is so relatable. I think it's hard too, for me personally at least, when I go to see a new physician, not to be on defense mode, and not to feel like, okay, they're not going to believe me, they're going to doubt everything I'm telling them, they're not going to listen to me, just because, we've all had this happen so many times, that to be open to a well-intentioned doctor from the beginning is a very, very difficult thing. Now, Natasha, so understanding that there's a difference between doctors sharing information about a patient's care and collaborating about their treatment, how often is there a collaboration between physicians that's initiated from the physicians themselves, and not the patients saying, I need you to talk to this physician, this one?
yeah, I can only tell you from what I've heard from like patients, caregiver, other health providers, and from as well as my PI of the study, from their experience, it happens quite often. Typically, they refer the patient to a specialist, which opens a conversation between them about the patient's care. But from my patient's point of view, from what I've interviewed from caregivers, it seems like a lot of the patients they come to their primary and they talk about what's going on. The primary figures out what's happening, and then they're like, oh, this is a specialist, reach out to them. And then it's like the patient being the one trying to encourage that team-based kind of format for their healthcare. But it's really challenging depending on location and how reliable or well-intentioned the PCP is. So, but yeah, from my personal experience, I don't know. I couldn't say from my professional, but from what I've heard and from other medical professionals, yeah, those are there.
Okay.
I'm curious about something. Has technology affected this at all? In other words, since COVID, video conferencing with doctors has become pretty standard. So I would think that it seems anyway, that it should be easier for doctors to collaborate with each other and even with the patient. Now that we have this technology, have you seen any effects or heard of any that having a positive impact?
The only time I hear of technology being used, the patient's usually frustrated because they're like, we're talking through a video. How are they going to tell what's happening to my physical body? I haven't heard of any. I can't say about collaborations. I feel like from my boss's point of view, as a researcher, they're constantly busy. So I'm not sure how that video chat's going on and meetings are. But yeah, that's from what I've heard from.
Right. Have you seen it, Rosa, that it has had, because I keep reading articles about how, specifically with EMS workers, that you're able to now collaborate even from the road when you're handling emergencies. I don't know how true that is, but I've read that that's like the latest and greatest thing now to come about. Do you see any of that?
I haven't seen any of that in real life. I think there's a big difference between collaboration and information sharing. Let's say information sharing has gotten much better in an effort to streamline medical care, but I feel like it's very often harmful rather than helpful, because doctors can access patients' records without permission. Even if the patient meets a new doctor and is open to educating him or her, there's the risk of the doctor accessing the patient's records available in the open medical system.
Oh, wow.
So before even meeting the patient, this has happened to me multiple times, the doctor can read slanted reports from other doctors that are not knowledgeable and might have attributed symptoms to anxiety or another cause. And it just perpetuates the cycle of misinformation.
Wow, I didn't even think about it from that perspective. I mean, you're right. Information and collaboration are two radically different things, but I didn't even think about that from a preconceived. So you're saying that their doctors are they're making decisions about you and your care before they've even met you and heard directly from you. That would definitely be a negative.
If I had, let's say, a cardiologist who said, oh, the reason your heart rate went up on the tilt is because of anxiety. You were anxious that we were tilting the table upright. So that report goes on to my, medical records. And then I land in the emergency room, even if it's because my cardiologist sent me to the emergency room. And the emergency room doctor opens up my file and reads that report. They say, okay, hypochondria. And they send me.
Wow.
Right.
So that's the difference. I think it's information sharing has gotten much better, perhaps not always to patients' advantage, but collaboration, not really.
Not much. Yeah.
Well, so Rosa, how do you think from your perspective that we can increase, or that anyone can increase, collaboration within the medical community? Like, is there something we can do as patients, or do you think that's more that the medical professionals have to do that themselves?
So I think there's two parts. I think medical professionals need to learn to trust patients.
Yeah.
That's easier said than done. But aside from that, from a patient's perspective, until that happens, medical professionals still do automatically trust other medical professionals more. So if you have something like a letter of introduction or something you can get from a doctor who knows you and can attest to what it is that you have, that you can show that could be very helpful, because doctors will automatically trust doctors more than the patient, for better or for worse.
Unfortunately, I think that's very true. Now, Natasha, have you heard of any patients that you've interviewed who have done anything to kind of be more open with physicians, or try to get their physicians to be more collaborative with one another?
Yeah, most definitely. I think a lot of the patients or even caregivers, they're always like making sure of any changes that are going on. They bring all their file work. Like even when they're meeting new doctors, they have like a file that they bring with them and explain that. And they've also mentioned how being having that information prior kind of ruins that relationship in the beginning, because you've already had these preconceived notions of what my condition has and how it has impacted my life or their life. And yeah, so a lot of them are really willing to tell them what they've learned about their illness, what they've dealt with, how their treatment was, and they put a lot of information out there. And maybe it's not always in the right packaging that doctors can really take it in, and maybe doctors just don't listen often and aren't taking everything in as they should, like all the symptoms, how can that be impacting their health, their treatment, and such like that. But I do hear patients really try to be candid about what's going on with it, especially when it's chronic, because I feel like they feel the least heard when it comes to a chronic condition. And so they give as much as they can on what their experience is. At least that's how it is.
Yeah.
I find being in kind of a unique position of being a patient, but also my husband just recently was in the hospital for most of the summer and was unable to speak for himself much of the time because of the medications and confusion that he had, and from being in the hospital for so long. So I find also the collaboration from a caregiver's perspective, that there also is a very low level of listening or dismissiveness that can go on from some physicians in that setting as well. And it's interesting to me, and this may just be kind of a coincidence, but when I've been in the hospital and my husband's been in the role of caretaker, and he speaks to my medical condition or whatever, they're very attentive to what he says. They believe him much more so than when I'm the caretaker and he's in the hospital and I'm speaking to the doctor and saying, no, he's saying that doesn't hurt, but he was just up moaning in pain for 4 hours that his leg hurt. Now he's kind of drugged, so he doesn't, but he is having pain. Like, they have frequently told me, just relax, just take it easy. Why don't you go have a cup of coffee? Like, the hysterical woman kind of situation that I think still exists very much so in a mainly patriarchal system, which it is. So I think from that's a barrier, as well as getting doctors to collaborate with one another rather than just share information. I definitely think that that's a big stumbling block for most patient care, is that doctors don't really necessarily, the way the system is set up, frequently you're not even talking to the same doctor. In a hospital setting, you have the doctor who's in the background, and you have residents, and you have, in teaching hospitals in particular, you have a parade of people going by who may or may not have gotten the information from the other 3 doctors you spoke to earlier in the day. So I think that's another, just the way it's set up is actually a stumbling block set up in advance that makes collaboration really difficult for physicians, even when they are well-intentioned. I don't know if that's been an experience that you've heard of, but
I've definitely, one thing I've heard most commonly, especially with the caregiving, they don't listen often. It's like, oh no, this is someone I care for, someone I know on a personal level. I know they're minimizing their pain, or they're not mentioning something such like that. But also, I feel like people they go to their local doctors, they talk about their experiences, and then they get referred to a specialist, and their specialist obviously knows a lot more, but there's never a initiative for the PCP to like keep track of like what this specialist is doing, what medications are providing. Most commonly I hear a lot of I was prescribed one medication and was told by my neurologist or whatever specialist that I shouldn't be taking this because of such and such, but my PCP knows I have a heart condition or knows I've had issues with my muscles in some way. And so they're all interacting and they're all providing all these things and medications and treatments, but like you have a patient and caregivers and their families confused by how they're supposed to administer these things and how they're supposed to take these things, and they have all these symptoms and they're not, and the professionals aren't linking the symptoms or the treatments together to really collaborate and help and benefit the patient in the end. So that's a lot that I hear, medication especially, from different doctors and professionals all the time. So
yeah, that's kind of frightening to think that you could be on a medication that would not agree with your other symptoms that your primary care would know about, but not the person who prescribed you the drug. That's definitely interesting. Like I know when I would go to appointments, and even now, but especially in the beginning, I mean, I had a binder I took to every doctor's, and I had my medical records, I had my symptoms, I mean, test results, like everything I could have in there, so that there was as much consistency as possible and everyone was seeing the same thing. But unfortunately, this seems to be pretty common, where the communication and the collaboration just isn't there. And like Royza, do you see this too, that there's a lack of I guess that is collaboration, but communication between your point of view for doctors and physicians from a patient perspective?
Definitely. I think it's in over 10 years that I've been a patient, I only twice had doctors actually initiate collaboration with other members of my care team. And from what I've heard in the dysautonomia community, it's slightly more common with specialists at like advanced academic centers, but even there, it's very rare.
And Ellen, so, go ahead.
No, I was just going to say what I've found is, even, again, it goes back to that point of the difference between information and collaboration. They share information, or they seemingly their version of collaboration is very different than what I mean by collaboration.
Yes.
So what I find 9 times out of 10 is that information is shared after action has already been taken. So in other words, using medication as an example, medication is given, and then the physician shares that information with whatever other specialist or primary care or whatever. And then at that point, after possibly some damage has been done, that's when the other physician finds out about it and says, oh no, they really shouldn't be on that medication because this needs to be done first, or they need this or that or that. But it's after the fact. They're not collaborating in advance. And with complex chronic illnesses, that should always be first, unless it's a life or death where emergency action is needed. You know, it seems to me it would make a lot more sense for the doctor to be collaborating in advance before coming up with a treatment plan, instead of instigating the treatment plan and then sharing it with the other physicians. That must be incredibly hard for you, Royza, in the EMS from that perspective, because you're always having to take action with no chance of collaboration in advance, correct?
Actually, we can call ahead.
Okay.
So if there is something that's, we have standing orders, which are, the regular standard of care. And then if there is a case that does need something different, or you would need to deviate from the standing orders in any way, then you are expected to call ahead to the emergency room and get orders from a doctor there.
Okay. Well, that's good to know at least. You
Yeah.
know, that's a positive.
Royza, have you had any, I don't know if you're an EMS, I don't know if you call them patients or,
Yeah.
okay, have you had any patients that have had dysautonomia that you have interacted with or been called to help?
Yes, not, I say that very, I guess loosely, because I don't necessarily, I can't diagnose people on the field.
Right, right.
But I definitely have had, if somebody says, oh, that's okay, I faint all the time, it's kind of sends alarm bells ringing in my head that maybe there's something else. And like, well, you start asking questions like, what makes you faint? Or, and you find out that, oh, they don't stay in the grocery store if they see there's a line, because if they stand on line, they'll faint. So then you can try to nudge them in the right direction of, how they should follow up.
Wow.
Wow.
Yeah, that's crazy. And they don't, like, no one says right off the bat, I have POTS or orthostatic intolerance. It's just they tell you, oh, I've been experiencing this.
Yeah, well, I mean, I do, but honestly, if I passed out and somebody came and I told them, oh, it's okay, I have POTS, they say, what's that?
Yeah, that's true.
So I'm not sure it helps anyways,
Right.
because I mean,
Yeah.
I wear a medical bracelet that says I have POTS and that I should be given IV saline. And in my experience, it's not actually helpful. I still wear it, but they'll kind of be like, oh, her heart rate's not, it says tachycardia on her bracelet, but her heart rate's not high. It's very unstable. It's just going high to low to high to low. So that's not the problem here. So we shouldn't give the IV saline. Like, it just,
Right.
because there's such a lack of education.
Yeah,
I'm not sure having the diagnosis is much of a help.
Yeah. It's funny. I've been trying to explain POTS. Like, I had blood drawn the other day and I haven't had it in a while, and it was more than I normally have. And I told the person who was doing it, I said, I have a condition that gives me low blood volume. And I was trying to think of a way without having to say postural orthostatic tachycardia syndrome. And I hope that it made it better to understand that. I almost wonder if there's a way to explain it without saying POTS, but saying I have orthostatic tachycardia and orthostatic intolerance. And maybe that'll be easier for people to understand in emergency situations or just in general, that, oh, and then you say you have POTS and that's what that has, because you tell people you have POTS and they have, or dysautonomia, that one at least is a little easier. I would hope you would hear the autonomic nervous system part in there, but
No, they don't.
I mean, they don't. And like, Natasha, have you had a lot of patients that go to the emergency room that you've heard from?
Yeah, I have like patients that go and they have a chronic condition and they have to go to the ER to get anything. And then they'll talk about, I like kind of like you guys mentioned, you have to divulge kind of like everything as quickly as possible, but like, does that really help in that situation? Because you're still sitting there waiting and they're not really doing what they should be doing because they don't want to listen. Like especially if you go to from chronic conditions, from what I understand, you go to the ER, you go to the doctor pretty routinely, whether it's for something that you didn't know was going to happen or not. So you know what you have to do because it's your condition, and they still, like you said, they're still not listening. It doesn't really help. It's just, I was like, can we just get through this quickly? I hear a lot of people like, I'm just trying to get an out, and they want to sit there and they want to figure out what's wrong. And I'm just like telling them what they can do. And
Right.
Well, doctors talk a lot about thinking outside the box, that they have to you know, that's something that they need to aspire to think outside the box. But at the same time, though, when if you're the one holding the box, you know, and you're trying to get them to see that most doctors do not want to be told by a patient, I know about this more than you do.
Mhm.
Yet really good, again, we go back to doctors you should be seeing and doctors you shouldn't see. Really good doctors, well-intentioned physicians, will acknowledge that the patient knows their body better than they do. Because even, you know, especially in chronic conditions, that most people with chronic conditions have more than one thing. There's usually multiple layers to illness. So, you know, you know what is attached to what most of the time. You know that if you're lightheaded and you know you didn't have much to drink that day, you know what effect that has on you if you have POTS, for instance. But you also know, you know, what a wound looked like, you know, what it looked like yesterday compared to what it looks like today. You know what your edema looks like compared to last week, what it looks like now. You know, you've gone through these rounds many times and the doctor hasn't. So if it's a good doctor, they should be acknowledging that you know your symptoms and your condition better than they do. You know, if they're good. Again, that's like, we should come up with a list of the things to look for in a doctor to know whether you should continue seeing them or not.
Really?
But that's one of them, I think, is, you know, how well they listen, but how much stock they put in what you're reporting to them about, you know, about your condition. So.
Yeah, and it's so hard to find a good one. I hadn't seen I've been having a bunch of GI issues and have been putting off seeing a doctor because I got burnt out with seeing so many and trying to find a good one. So I finally got up the courage to go see a gastroenterologist, and she had great reviews online. Everyone loved her, 5 stars. You know, she had this video about how important patients were to her. So I had to wait 6 weeks to see her. I go in and it's a total bust. I talked to the nurse practitioner for probably 15 minutes. And then the actual physician comes in, sits with me 5 minutes and said, okay, we're going to do this. I'll see you then. And it's like, you know, it's like we need a dating site for doctors or something, like a match.com for doctors or something. Because even if other people like them, if you catch them on a bad day or, you know, whatever, it is so hard to find a good one. And I'm seeing another one now, actually this week. So you don't want to come in with this negative mindset, but it's like, you know, you have to go in with this open mind and this, like Royza said, this appreciation for what they're doing. If they are, you know, if you do feel like they're well-intended, and come in with this open mind, like, okay, and not bring all that negativity with you, because then you'll just start off off a bad start. Which, Ellen, I know you've had many experiences, as you said, with bad doctors. I'm sure we all have.
But I can just quickly, on the good side, I had an experience recently that I think we can all relate to. I have an excellent cardiologist, as a specialist in a very particular part of disorder of the heart that I go to. He's wonderful and very well intentioned. But again, this information versus collaboration before and after treatment. Okay, example, he prescribed me a medication that within 2 days of taking it caused me to basically not be able to lift myself off the floor. It set off a flare of POTS and other things that were just, it was one of the worst episodes I've had. I immediately called up, spoke to his nurse and said, I think it's the medication. She spoke to him and said, no, the medication wouldn't cause that. It's a coincidence. So I said, okay. And I went back and then I researched, which I probably should have done to begin with, but I researched the medication myself and found out that it was indeed it triggered a specific hormone that is nobody with dysautonomia should take. this medication because of that's going to be an effect. Now, because he is a well-intentioned, good doctor, I had to advocate for myself. And I called up again and said, listen, I did a lot of research on this, and this is what this medication does, and it's anti-dysautonomia. And he got on the phone and he said, well, I really don't know much about dysautonomia. He said, can you send me the information that you found that says this is not a good drug for this condition? So I said, sure, I will. He said, and in the meantime, stop taking it. So I said, okay, because I had already stopped taking it, by the way. But I sent him the information and he did research it. And he came back to me with an apology and said, I promise in the future, I will check on this in advance before giving you a medication again like this. And I thanked him. And I came away from that experience saying to myself, okay, number one, I should have advocated for myself sooner, in that I should know that there are some medications that just don't, even though they're not listed as, contraindicated for certain conditions, dysautonomia is not going to be listed. But I need to know that, and I need to advocate for myself in that regard. But I also came away feeling very secure that this was a physician that I can work with, who is willing to collaborate with me about this going forward. So I think it does also involve all of us as patients being really good, strong advocates for ourselves, because we do hold, like I said, more of the resources in education than they do in the case of rare illness. I'm sure, Natasha, you must hear about that all the time, about people needing to advocate for themselves.
Yes, that is always how every interview ends, is we ask, what advice would you provide for health professionals? And also, what advice would you have for anyone who also has that health condition? And every time it's like, you really have to advocate for yourself. You have to gather as much information as you can, and you have to advocate for yourself and learn to say and learn to leave a doctor. The best ones I ever hear, that one's like, learn to just leave. You can fire your doctor and just go another one. And but yeah, yes, most definitely, those are always mentioned in every single interview I've done, is self-advocating and what that's been like for them, and the process of learning how to do it and what's the best way to do it. And yeah.
Are there any specific pieces of advice that come to mind that have really stuck with you or stuck out to you?
Oh, wow. There's
I hate to put you on the spot, but
there's so many. I've very recently, I've been mainly just interviewing people with a rare genetic disorder. And these are people who didn't have available research for blood work back when they were first getting symptoms. And these are they had generations of family with this disorder who had passed and that were misdiagnosed. And then blood work was finally able to be oh, well, these things are connected and such like that. And the thing is, there's no treatment. So their health just may decline or may plateau, depending. And so they deal with it chronically. It's just constantly, certain things they're not able to do. At some point, they're not able to move at all. In this diagnosis, it's possible. It's very rare. You don't know how you'll be in 5 years, 10 years, 15, if it'll be that long. And I think one of the, it's every single one of them say it's very rare. So your body, exactly what it reacts to, exactly what you do day to day, especially if you don't have that much mobility at the moment or time. And so you really have to stick with your guns. You really have to, don't let them question yourself. Don't let them tell you that something isn't out of the normal, or that this is normal, or that and it may be chronic and it may be untreatable, but don't let a doctor's the perception, because I think when doctors or medical professions are confronted with something they don't have the ability to fix, they feel that just means it's a worst case scenario, and it's just they don't know how to facilitate that kind of positive talk and motivation, and just compassion and stuff like that. And so that, I think that's one big thing is for themselves, that they know themselves and they know their body, especially in relation to this genetic disorder. And they can't be compared to other patients. And there may not be other patients that the doctor has, but that's one of the biggest things is that people should know, they know their own body. And so you stick with it.
I will tell you from personal experience, it is much easier for me anyway. I am not a confrontational person at all. I'm definitely a peacekeeper. So I have a very hard time actually speaking up. And then afterwards, there's like all these things I want to say to them and tell them. But in the moment, it just shocks you. And I'm usually just speechless and I get emotional. It's like you put yourself through all of this, and you're going through this, you get brave enough to go see this next one. And then it's such a disappointment and such a letdown. It's very hard to keep that momentum and to stay strong and advocate for yourself, because it's very easy just to accept and believe whatever one physician's telling you. Roisa, how about you? How would you feel is a good way from your perspective to advocate for yourself, or anything that's really stood out to you from what you've seen?
So I think there's two things. One is if your doctor sees that you're knowledgeable and intelligent, like Ellen was saying, not just that you Googled your symptoms, they're much more likely to take your thoughts into account. So if you go to your doctor with scientific studies, then you drive the doctor to initiate cutting edge evidence-based treatment. If you're lucky enough to have a doctor involved in research, then I highly recommend following his or her writings, discussing them at your appointments. I found that very helpful because also, aside from those benefits, it shows you value and honor your doctor's academic achievement. So it's just conducive to, a good feeling, and they want to help you. On the flip side, though, unfortunately, the medical field is very depersonalized. So medical professionals identify patients by age, sex, medical condition, right? So I do this myself. It's, we have a 52-year-old female diabetic presenting with hypoglycemia, and that's what it is. So it helps make treatment decisions without getting too emotionally invested, but it eliminates the more human and humane aspect of healthcare. So I want to be seen, I want to be heard, I want to be treated as a complete person with as much, communication and collaboration, education as necessary. So as a medical professional, it's important to recognize the human aspects of patients. And as a patient, besides for the education and the knowledge, it's vital to share some of your human side with doctors. Talk a bit about your job, your family, your hobbies, anything that will help the professional make that mental shift from patient to person.
That's an excellent point. That's a really excellent point. I've found too that sometimes explaining to them what your goals are in treatment, I always make the point with new doctors that I understand that this is I'm not talking about POTS, but I understand that this is a deteriorating condition. I understand there is no cure. I always make that point so that they know I'm not in denial. I'm not asking you to fix me, to cure me, but my goal is, and I'll state whatever my goal is. I would like to be able to prepare a full holiday meal without needing to take a nap, or I would like to be able to take a walk with my granddaughter again. Sometimes breaking it down, it gives them the human aspect, but it also lets them know that you are realistic about what is going on with you. You're not, because I think a lot of patients, unfortunately, are in denial and they are seeking that magic pill. When Dr. Raj, with the last session that we did that premiered yesterday, he talked a lot about that there is no magic pill for this. This is a disorder that does not go away. It's a disorder that you have to learn to live with. And there's parts of it that are very uncomfortable and that are not conducive to the lifestyle you may have wanted for yourself, but they are what they are, and you have to learn to live with it and find the things you can do and not focus on the things you can't. And I think it helps doctors to hear that from the patient too. I think that's another form of advocating for yourself. This is what I want. I want you to help me take that walk. Tell me what I need to do. Is it exercise? Is it medication? What do I need to do to take that walk? And then they feel that accomplishment that you feel also when you manage to get to that goal. I think it just follows with your points about being able to do that, to make yourself human for them.
I'm almost wondering if there's a benefit when you go to see a new physician to say, like, I'm really hoping you can help me. I've experienced XYZ for this amount of time. No other physician has been able to help me, just to let them know, again, to bring that human connection. Because a lot of times you feel like a number, like, okay, I got to get through, this is patient number 5 today, and I just got to get them in and out really quick, or like a guinea pig, and oh, well, let's try this and see what happens. Which at least they're trying. But I think I totally agree. To get that human personal connection, I think would be really, really beneficial. And Natasha, I'm sure you've seen that countless times with all kinds of conditions, I'm sure. Yeah.
Sorry, what was the question?
Right.
I just kind of lost my train of thought there.
You're totally fine. Have you seen like a lot of patients that have complained that doctors don't have like that personal connection or human feeling, that they're like a number?
Yeah, oh, most definitely. I don't visit the doctor often personally because of that reason. And last time I did blood work, so it was fine. I specifically picked a physician that I had heard was good. But most commonly they feel like a number, especially if it's local and they go to that same one all the time, and they don't have the ability, or they don't have the access to other, like for school academic research, medical centers or anything like that. They feel like they feel kind of lost, because sometimes with the PCP that they've had for years, and then they've had this condition, it's just like they kind of just feel like they're just doing what they need to do to get through the motions, and then they'll visit specialists, or they'll go to these academic institutions with researchers, and they'll also feel like they're not able to really share their whole experience. And they're just only providing these symptoms and what's the condition and what's my blood work and such like that. And they're not able to be like, this is what my life is like, and this is what every day is like, and this is how I have to manage it, and this is what I want changed, and this is what I want worked on, or what are my options. I think a lot of them are just looking for not only a connection, the ability to share what their symptoms are and what their experience is like with this condition with a professional, but they also they're seeking information, they're seeking resources. If you can just provide them that, if there's just a way to be like, oh, I don't know, if you just admit, I don't know, here's some options, here are some things, you could really see a difference in like the trust in doctors from patients. Because I think a lot with that is that patients are distrustful of like, are you really telling me what's going to help me, or just telling me what I want to hear? Right. Are you even listening, or like, do you even remember what you said last time? And I want to reiterate that patients know and caregivers know that doctors are busy and medical professionals are overrun with patients. They see that, but at the same time, they only have you available as the expert. So, and they can do only so much research, but before they have to talk to you and be like, so here's my information, what can I do? So,
Right. Oh, yeah, definitely. So the last question I have for you lovely ladies, we'll start with Roiza. So what major insights have you gained throughout your career that you'd like to share about communication, collaboration, education that have really stood out to you?
I think the most important is really what we were talking about, the human aspect of doing whatever you can to show your doctor that you're, a real person. You're not a patient with XYZ condition. You're a person, and you have symptoms and concerns that you want to deal with.
Yeah. Natasha, how about you? Is there anything that's really stuck out? I mean, I know all of us have definitely, seen this on a very personal level, but what has stuck out to you with that aspect?
I guess with my job, it's the same. I'm constantly, so I work in social, I'm a social worker. So I'm constantly meeting people at different points. Like they need medical help, they need legal help, they need something like this. And so it's very easy for me to be like, oh, there's multiple facets to someone's health condition, and what's going on, what could be possibly impacting that. And so, but I guess one thing about my job and what I'm currently doing in the story booth is that I actually get to sit down and listen to various people's experiences. And they all have like common themes of like what's happening with them in the medical system and how the medical model currently isn't very helpful, and it's not patient-centered, and it's not doing what it needs to do in order to create a good collaborative work and communication. And one thing is just listening.
Yeah.
And I interview people for the whole thing happens in 45 minutes, but I get all their personal things and their experiences in 20 minutes. And I have to, in a way, understand what they're not telling me, because they're not going to divulge everything, and they don't want to be viewed as like a complainer, but they do want to present things as how they are. And that's the thing, that's a real big thing. Like all these people, they don't want to sit here and complain to me. They just want to share their reality. And just I sit there and listen for those 20 minutes, and I have to ask engaging questions to really explore and get what's happening for them within the medical center, because it's a lot. And there's a lot of bits and pieces, and every story I listen to, I hear another part of the system that puts roadblocks in its way to get, to feel like they're being heard. So yeah.
Yeah, it's funny. It seems like no matter what illness you have that's chronic, if it's an invisible illness, I feel like most people in general can relate to this. It's not just POTS and dysautonomia. This seems like a very common theme. And even if you do have a physical illness, as Ellen said, her husband was in the hospital and she had to deal with this. But Ellen, is there anything that has really stood out to you, especially after this summer, about collaborating with doctors?
Yeah, I think we're trained from a pretty early age to be good patients, to be the good little girl, the good little boy who does everything the doctor says, doesn't question that they know more than you do. And I think we're trained with that mindset. And I think the thing that I've come away from, not just through my personal experience, but also through listening to all of the people on the forum through DINET, is that we need to remember that we work for ourselves and they work for us. They are a hired professional. And the same way that if I hire an accountant and I'm getting, audited by the IRS every year, well, then I have to question whether this is the right accountant for me. The same is true with the doctor. I think we need to remember that they do work for us, and they are highly educated professionals with years of experience, but they still do work for us, and we work for ourselves. So we need to insist on being heard, and we need to insist on doctors informing us what they're doing, why they're doing it. And if they don't have the time or the patience to, explain to us, to let us be part of the collaborative process, then they're not the right physician for us.
Mhm.
And, personnel, like in anything, I think you have to remember that personalities come into play. And sometimes a doctor could be excellent, but if their personality doesn't jive with yours, then that's not going to work either. I mean, it has to be somebody you can trust and feel comfortable enough with, that you can tell them some of the most intimate, distressful parts of your life, So I think remembering that you have to advocate for yourself, you have to back up what you think with evidence-based science, not just Googling something and saying you heard it somewhere, somebody told you something. Do your own research. That's the best way to advocate for yourself. Make sure that they're listening, and just remember that they work for you, and fire them if they're terrible, if they're insulting. I've been insulted. I had a doctor once say to me, "How the hell do I know why you can't breathe?"
Oh my
I'm
gosh.
startled. And I started to cry and I am not a crier. Okay. I'm usually very confrontational, but I was at such a low point. I started crying and I said, "But I came to you to find out why I can't breathe." And he was like, "Well, I have no idea. We ran the test and I have no idea." He was frustrated that he couldn't figure out what was wrong with me. But instead of him figuring it out or sending me somewhere else, he was annoyed with me that I kept asking him a question he couldn't answer. And I collected myself and fired him immediately. But that's just an example. I think as patients, we take, even the strongest person can take a lot of abuse from other people when you're at that vulnerable a position. So having somebody with you who can advocate for you when you're unable to is another thing that I think is critically important for good care going forward.
Most definitely. Is there anything that any of you wanted to bring up but haven't been able to, or that we didn't touch on that you wanted to discuss? No? Okay. Oh, Natasha, go ahead. Was there?
Oh, no, I would just mention there's a lot apart. This is for patients, caregivers, and obviously healthcare professionals as well, especially healthcare professionals. Like, there's a huge part of the medical system that they don't have to interact with that the patients do. And that's Social Security, that's insurance, that's billing, that's all these other things. And I think we have to also, as medical professionals, as social services, as anybody who works with people, there's like a lot that regular people have to interact with in order to just get a visit to the doctor. And then you were in there for like 20 minutes and we waited 30 minutes or an hour. And so I think that's one thing to know, is that it just doesn't end with the symptoms and them going to the doctor and being prescribed medication. It ends with arguing with insurance, arguing with specialists, arguing with researchers, finding research. And I think that's a big component in that, that when it comes to collaboration and communication, that I get it a lot because people share it, but is there a conversation about insurance going on? Is there a conversation about medication, pharmacies, location going on? And that needs to be had. So that's one thing that I would want to mention, is that there's just so much that people have to interact with, and so many systems that you have to navigate through in order just to get mediocre healthcare. So
It's funny you brought that up, because Ellen and I had actually talked about that point for a potential another video to discuss, navigating the healthcare system, because you're totally right. I mean, they don't think about, well, what if you have to drive 2 hours to see that doctor? What about your insurance? What is it going to cover? Is it even worth waiting, an hour in the waiting room and then seeing the doctor for a few minutes? And then, well, what if it's a total bust? That's your whole day. That's your energy that you put into that, along with your money. So no, that's awesome. I know Ellen and I would love to do another segment in the future on that. So I just want to thank you all so much for coming. Before we get any further, I want to again thank our sponsor, Banana Bag Oral Solution. Without them, this speaker series would not have been possible. We really hope that you guys learned a lot. I want to thank Natasha and Royza for joining us. And we all really appreciate the work you guys are doing with Story Booth and my team, and continuing to create much, much needed understanding and awareness. And for all things dysautonomia and POTS, please visit DINET.org. Thank you so much for watching. Be well, everyone.